So at this point, I'd like to invite Dr. Maryanne Bombaugh to the podium. Maryanne, with this ribbon and this medal, I congratulate you and wish you well as the 137th President of the Massachusetts Medical Society.
Wow. Thank you, Dr. Chowie. And on behalf of our Massachusetts Medical Society members and Dr. Rossman and myself, thank you for your work and leadership this past year. And thanks to everyone here tonight. It is really great to be with you this evening. It really is. Before speaking with you about the exciting new work planned in our medical society this year, I want to take a few minutes to give thanks and recognition to some very special people and friends who are here tonight, who have been and are important in my life's journey. I hope that by sharing these thanks and recognitions with you, that I will also be sharing with you some sense of me and what drives my desire to serve and to work on behalf of each of you in our profession. I want to begin by saying thank you to my colleagues from the Community Health Center of Cape Cod who are here tonight and somehow braved the traffic to get here. Thank you for your incredible dedication to patients and for always honoring your mission to care for all persons, regardless of their circumstances or their conditions or their ability to pay. You are an inspiration to all of us. Working with you is an honor and a highlight in my career, and I thank you. Thank you to my colleagues on the board and management at Coveris for your demonstration that corporations in healthcare can truly be innovative, accountable, sustainable, and importantly, ethical when board and corporate leadership embrace those values. Thank you to my mentors and friends here tonight who taught gently, encouraged me, and are always there in good and not such good times. I am very grateful for your friendship and mentorship. To members of our MMS Committee on Strategic Planning, Board of Trustees, and Senior Management, as well as Ann Coughlin, Allison Stitham, Linda Healy, Karen Harrison, Amy McInerney, Jeff Surratt, and my colleagues Dr. Rossman and Dr. Chowie, thank you all for your engagement and selflessness this year as we worked on the new strategic plan for our medical society. Thank you for your incredible work that has resulted in an exciting new strategic plan and strategic planning process that will position our medical society for success in achieving our vision for healthcare, education, advocacy, and publishing. Thank you also to our new Women Physicians Task Force, which I also had the privilege of chairing this year, that accomplished a year's worth of work in 2 meetings. Amazing. And the members did this so that the section could begin its innovative and compelling new work to advance equity for women physicians in both professional opportunities and leadership. Amazing work. Thank you. I especially want to thank my parents, Mary and Ed Clasby, who are here tonight via FaceTime at the ages of 92 and 93. Yeah. Yeah, pretty amazing. Thank you for your constant love and for sharing your faith with me, a faith that is my compass. Thank you also to my mother-in-law, Martha, for your love and support over many, many years. To my 2 sisters, Beth and Amy, and my 2 brothers, Mike and Sean, who keep my life grounded. Thank you for our shared lives, for for our truly unbelievable stories and experiences and all the laughter, lots and lots of laughter. Thank you to my 3 sons, Keith, Teddy, and Sam, who are my best teachers, bring me joy and share perspectives on life that are way beyond the years. Thank you especially for enjoying taking call in the hospital with me, not only for the apple juice and tuna sandwiches that were always there for you in the fridge in labor and delivery, but because it was a special block of time you could actually spend with me during long weekends on call. I love you, and thank you for wanting to spend so much of your time over the years in places never dreamed, like hospital call rooms and medical conferences, to be with your mom. Yeah. This past October, we were blessed to have our first grandchild born. Eli is our joy, and thank you, Sam and Kim. And now, with all my heart, I do want to thank my husband, Keith. Our life has been and continues to be an incredible journey, from our start as town lifeguards in high school until now. You are my best friend, my strongest supporter, my comfort, and I can be here today because of you. I love you. As you see, there are many to thank because after many, many years of life, there are many people to thank who guide, teach, and mentor us. So before we have our dinner tonight, there are 2 items I would like to share with you that will be driving our work and mission at the MMS this year, and likely for years to come. The first item is our new strategic plan, and the second item is a call for action. I will start with our strategic plan. This next year will be a critical year for innovation, sustainability, and strategic initiatives at the Massachusetts Medical Society. And for the next few minutes, I would like to tell you why. In September of 2018, our Committee on Strategic Planning voted to conduct a review of the MMS strategic planning process to determine if the current process best supports our Board of Trustees as the board guides and assesses the future direction for the Massachusetts Medical Society. Given the profound changes in the healthcare landscape ongoing right now, coupled with the equally disruptive changes in the publishing and media business environment, the Committee on Strategic Planning undertook the effort to identify key drivers of change for advocacy and member relations, as well as for the publishing side of the organization, and then define those implications for Massachusetts physicians and the MMS. To accomplish this, for the first time in MMS history, the Committee on Strategic Planning, the Board of Trustees, and the MMS Senior Management Team participated in a collective strategic planning effort. So, what does the new strategic planning process mean for patients, physicians, and the MMS? It means that barring extenuating external or internal environmental issues, the goals of our strategic plan will be the focus of our work for at least the next 5 years. The objectives that will be measured and the strategic initiatives being done to achieve the goals will now be reviewed and discussed regularly by our Board of Trustees and changes made as needed. Reports will continue to be presented to the House of Delegates yearly. So what are these aspirational future goals in our strategic plan for patients, physicians, and the MMS as an organization? First, for patients, the goals are that all people will achieve optimal health and well-being through patient engagement and improved health literacy and equal access to timely, comprehensive, affordable, high-quality, integrated health care throughout their lives. Second, for physicians, the goals are that physicians will enjoy a satisfying career in medicine that is grounded in high-quality care, intellectual growth, and financial sustainability in an inclusive environment with minimal regulatory burden. And third, for our medical society, the goals are that the MMS will be the most trusted and respected leadership voice in healthcare, advancing medical knowledge and the medical profession to improve patient care and outcomes while maintaining a sound financial position and a diverse, engaged, and expanding membership. It was very important to define these goals, and they certainly sound lofty and aspirational. So what do these goals really mean in terms of our work for patients, physicians, and the medical society? Well, for patients, it means we will be laser-focused to prioritize the most critical individual and public health areas that have impact on health, well-being, and patient engagement. This means we will work to assess the adverse impact of social determinants of health and health disparities on vulnerable populations. Vulnerable populations that we know encompass all ages, genders, geographies, ethnicities, races, socioeconomic statuses, and insurance plans. We will do this work as an organization and more broadly with coalitions. For physicians, we will work on 4 critical and immediate initiatives this year. The first, we must improve the social determinants of our own health, what we know as physician burnout. To enjoy the goal of a satisfying career in medicine, the conditions in which we work that affect our health, our quality of life, and our health outcomes, our social determinants of health, must be recognized, measured, and addressed. Second, to work to identify, advocate for, and measure the success of 3 high-impact initiatives to reduce the unnecessary regulations and administrative burdens, one of which certainly will be prior authorizations. Prior authorizations that are now not only a significant administrative expense and inconvenience, but now have become a patient safety and quality of care concern. Number 3, to lead change in healthcare by advancing leadership, system science, and advocacy training for our physicians, students, and physician-led teams. Our involvement in health systems and reform in the future will require this training and experience. And number 4, to commit to finding ways to increase the affordability of medical school. Many of our medical students currently in training are burdened with enormous debt, a concern with debt that contributes to the highest rates of medical student burnout and suicide that our country has ever seen. This must be addressed. And our MMS strategic plan is committed to finding ways to increase the affordability of medical school to include the option of free medical education. And for our medical society, we will focus on operations and initiatives that will assure excellent stewardship and sustainability of talent, membership, and resources so that the MMS will be the most trusted and respected leadership voice in healthcare, a voice that advances medical knowledge and the medical profession to improve patient care and outcomes. And as we seek to improve patient care and health outcomes as a medical society, we will increase our engagement and collaboration with key stakeholder groups. I hope to find time to speak with you in the near future on the strategic plan, and I will. And we will delve much more into the specifics. But until then, I will tell you that I am incredibly thankful for the work and collaboration that have gone into this landmark strategic planning process, and I am really beyond excited to see what the future holds for our organization. The Board of Trustees, Dr. Rossman, Dr. Allen, and I need your continued support over the next few years as our strategic plan moves from a plan to an exciting and sustainable future for our communities, physicians, and the Massachusetts Medical Society. And now to the call for action. Long ago, before going to medical school, I was a graduate student in epidemiology and health policy at the University of Massachusetts School of Public Health in Amherst. One of my professors at that time, Dr. Robert Tuttle, would often express his concern with the siloed manner in which both health care and medical care worked in our society. His major area of research concerned the effects of highway salting on groundwater and its link to hypertension in the environment. He would say it is the environments in which people live and work that make the biggest differences on health, and that by addressing health factors in these environments, we can have the most meaningful impact on health and the prevention of disease. His wisdom has had lasting impact, not only by resulting in the elimination of routine salt use on roads in Massachusetts, but in the broader definition of what we now consider health. Our capabilities with digital communication and data now inform us of social and economic issues that affect outcomes in healthcare, outcomes that previously had not been identified as being related to health, but in fact are. We know that many patients considered non-compliant with care actually have challenges with transportation or childcare. The use of car-sharing companies and telemedicine have opened doors to mitigate compliance issues and improve health outcomes. For example, my own parents, who live in an extended care facility, are able to be monitored remotely for many of their health needs and follow-up appointments through the use of an iPad connected to their primary care doctor's office. Our society and our patients look forward to a future where barriers are overcome so that health and healthcare happens when and where it is needed. The health and healthcare needs of our communities, our state, and our society are changing. And as you see, our work in advocacy and the varied health lanes related to social determinants, such as telehealth, housing, food, guns, care integration, and team care, must continue. But we need an overarching healthcare principle as policy to help us set a vision for this work. That is why your officers and Board of Trustees unanimously support, as a strategic initiative for our medical society, the adoption of a principle that states this: the opportunity for health, including healthcare, in all its dimensions, is a basic human right. To be clear, this is not a statement on financing or insurance coverage, nor a statement addressing what is guaranteed in the United States Constitution or written in the Bill of Rights. This is a health policy statement that includes the social determinants of health, and it can help direct our advocacy. Advocacy for the improvement of the public's health, the public good, that is the core of our medical society's mission and is chiseled in stone on the building wall in Waltham. With your help and support, we can get this done. We can make this declaration in our House of Delegates tomorrow, that the opportunity for health, including health care in all its dimensions, is a basic human right. Let's get this done. Let's do it. I look forward to working with all of you this year, and our Board of Trustees, our Medical Society staff, Dr. Rossman and Dr. Allen. I am grateful always for your support. To end, I would like to share two of my favorite quotes from people I admire. People who worked hard to make our world and life for people and every individual better. The first quote is from Dr. Margaret Mead, and she stated this: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has." And the second quote is attributed to both Mother Teresa, a Catholic nun and saint who worked with the abandoned and poor in India, and Elie Wiesel, a Holocaust survivor and human rights activist. And the quote is this: "The opposite of love is not hate. The opposite of love is indifference." Thank you all for your work. Thank you all for your work, for your advocacy, and thank you for not being indifferent. Because of it, we really do have the opportunity to change our world. Thank you.